Welcome back to Healthwise. With us is Dr. Stephen Weibel. Dr. Weibel, in addition to having a cosmetic and company or with IPS, he also does pain management at Doctor's Hospital. Doc, can you tell us a little bit about pain management? Because that's something, you know, people automatically think pain management is a bad thing, you know, but I guess they don't realize that it could be an elderly person that's having pain from surgery and all these different things. So kind of explain that and walk us through that.
Well, all physicians provide some degree of pain management to their patients. We specialize in providing care to mostly chronic pain management patients. We do take care of some acute pain management patients, but most of them are chronic, are patients with chronic.
Chronic as in?
Conditions that have been going on longer than 6 months.
Right.
That's the definition of a chronic problem, or a problem that after the healing phase has taken place, they're still having pain. So let's just say, for example, you break a leg and your bone is healed and you're still having pain. Those are the types of folks we see. We specialize mostly in back and neck pain and spinal related conditions, including everything from herniated discs to spinal stenosis to post-laminectomy syndrome, which is a patient that they've already had surgery and they're still having some pain even though they've had a very good operation. We provide a limited service for medical management, which includes pain medications. It's a very restrictive program that's highly regulated. We follow all rules by the state and federal authorities because it's a very controversial. It's very controversial to give out narcotics to patients who have what we call non-cancer pain or non-malignant pain, but we do it under strict guidelines. But our main focus is in interventional procedures and therapy. What we like to do is get patients to be as pain-free and as mobile so they can enjoy their life as much as possible. And we see a lot of folks that once they get into a pain crisis, they just retract. They don't want to get out of bed. They don't want to get out of their house. Their whole quality of life falls apart. What we do is through injections. We do quite a bit of different types of injections, including steroid injections as well as diagnostic procedures where we can relieve their pain. It's actually much more effective than just medications. These are all done with IV sedation, so they're minimal pain associated with these procedures. We have a certified X-ray technician, so they're all done under live, active X-ray. So it's a very specific type of service that we provide.
Okay. Well, what are some of the things, because you said y'all have some high-tech stuff,
we do. We have that's just the injection side. We also have patients that suffer from chronic back and neck pain, and a lot of times their conditions may not be a surgical problem, and it may not be something they want to have surgery on or can have surgery because of advanced medical problems. We provide what's called radiofrequency neurotomy, where a painful facet joint, which is a small joint in your back. It's when you put your head back and you hear all that clicking noise, that's your facet joints, that's your whiplash type injuries. We do diagnostic injections to diagnose that those facet joints are painful. Then we actually have a special device that we go in percutaneously with a needle and we sever that sensory nerve. We do all of our procedures are done in our office. Okay. So we have everything is under one roof, so it's very convenient for the patients. The other advanced treatment options that we have is some patients have what's called neuropathic pain. Nerves normally transmit pain to the brain where you've had an injury. The nerve lets you know that further injury may occur, or that you've had an injury. It's a protective device, but sometimes the nerves themselves become the pain generator where the nerve has become injured. And this can be due to trauma, disease. It can be due to healing phase of surgery or just a degenerative condition. This device is a little bit different. It actually works on the spinal cord level. We put very small plastic wires on top of the spinal cord, and we deliver electricity. It's like electrical medicine. And that electrical medicine blocks the pain response. We can treat patients who have leg pain, low back pain, as well as neck pain and arm pain with these devices. And we do it as a trial phase. So the first part of the phase is a 5-day trial where you get these temporary leads implanted. So it's a very low risk procedure. And if they like the device and it helps them, then at a later date, we're going to still take those temporary leads out. At a later date, we go to the Opelousas General Hospital where we do an outpatient procedure and implant a small electrical rechargeable battery that is very high tech. It's programmable in their bodies. It's like a pacemaker of the spine and helps control their pain. We also have other patients who require surgery, and when they require surgery, we have an excellent surgeon in town, Dr. George Ray Williams, who we refer our surgical patients to. So we have all modalities, including access to neurologists. Some patients need psychiatric care and counseling. We have that as well. And we have an excellent surgeon in town to provide we don't have all the services under one roof, but we have them all in a nearby location. We think it's a great addition to the community, and we're real happy with the results of helping a lot of folks improve their life.
Okay. Well, yeah, and I've heard about that, what you were talking about with the battery and the leads going to that, and that's amazing that they can do that, because without that, some of these patients would have nothing. They wouldn't have any help at all, and they'd just have pain all their life, and then have to end up, like you said, taking narcotics or something to relieve the pain, which leads to addiction. And you and I talked about in Florida the problem they're having already with the, people dying from overuse of prescription drugs. So we don't want that for sure. So, Doc, it was been a pleasure having you with us, and we hope to see you again on Healthwise. And audience, once again, Dr. Stephen Weibel at the Old Doctors Hospital. If you walk through, you can get there. You'll see IPS Cosmetics, and they got a big old waiting room, and it says pain management also. So once again, Doc, welcome.
Thank you.
Thank you for coming, and we'll see you next week on Healthwise.
Healthwise is brought to you in part by Opelousas General Health System.